Welcome to everyone. So we are from group 6. So we'll be presenting about the arterial blood gases. So these are the table of contents. So first of all, we look at the introduction. So what is arterial blood gases? The abbreviation for it is the ABG. So arterial blood gas is a type of blood test that measures the ventilation, the gas exchange, and also the acid-base balance, where usually the blood is taken from the artery. So for this test, the blood is actually taken from a specific artery, usually the radial artery in the wrist. So with this blood sample, they can exactly find out how much the oxygen passes from the lungs to the blood. So basically, the main functions the main function of ABGs, where we can find that how our lungs are getting enough, if our lungs are getting enough oxygen, if the lungs are removing enough carbon dioxide, or we can also find the kidneys if the kidneys are working properly. So this is one of the blood analyzer machines, as you can see here. The next, we'll look at the uses of ABG. So first of all, you can detect respiratory failure such as lung failure, acute respiratory distress syndrome, and sepsis. Another thing is the hypovolemic shock, where you can find if we have any acute heart failure or cardiac arrest. And other type of uses, you can detect kidney failure, septic shock, and as you can see here, hemorrhage, drug overdose, metabolic disease, and chemical poisoning. So how do we analyze this ABG? So there are certain key components that we should take note. Which first one is the pH, where it measures the balance of acid and bases in the blood. Next is the PaO2, which is partial pressure of oxygen. It will measure the pressure of oxygen of the oxygen dissolved in the blood. Next is the PaCO2, which is the partial pressure of the carbon dioxide, where it will measure the amount of carbon dioxide in the blood and how well the CO2 can move out of the lungs. Next is HCO3, which is bicarbonate, which is used to calculate, is calculated using the measured value of pH and the PaCO2 to determine the amount of the primary compound rate from CO2. Next, you can also, the key component is also the O2 saturation, which is oxygen saturation, where you measure how much hemoglobin is in the blood carrying oxygen. Next is the O2 content, which is the oxygen content. We will measure the amount of oxygen in the blood, as well as the last one, which is hemoglobin. It will measure the amount of hemoglobin in the blood. Next, we look at the interpretation of the arterial blood gases. So basically, there are four main interpretations. Where the first one, they will analyze the pH, where when the pH increases, the term is known as alkalosis, and if it is decreased, it is known as acidosis. And for the PaCO2, if it's increased, it is known as respiratory acidosis, and for the decreased part, it is the respiratory alkalosis. For the HCO3, when it is increased, it is known as metabolic alkalosis, and when decreased, it is known as metabolic acidosis. For the compensation, we have full compensation and partial compensation. For full compensation is where the pH range, it is within the pH normal range, and for the partial compensation is when the pH is not in the range. So next, I'll pass to my friend.
So now I'll talk about the working principles, where I go through the principles, tools used, and general steps and procedures. So first, for the working principles, ABGs can give useful information about the acid-base balance, blood gases such as O2 and CO2 in the blood, bicarbonate, lactate, hemoglobin, and electrolytes. There are four main conditions that you can find using AGBs. First is respiratory acidosis, respiratory alkalosis. Next is metabolic acidosis and metabolic alkalosis. So to go a bit more into the conditions found, which is related to acid-base balance, for respiratory acidosis, is usually due to a low pH, which is most commonly caused by the partial pressure of the increase in CO2. This is because the patient is actually retaining carbon dioxide and their bloods become acidic. Next is respiratory alkalosis, where too much CO2 has been let go and there will be a higher pH because of the lack of concentration of carbon dioxide dissolved in the blood. Next, we have the metabolic acidosis, which is again due to low pH and low values of bicarbonate. And the opposite is true for metabolic alkalosis, where it's a raise in pH because of the raise in bicarbonate. Next, I'll talk about the tools used. There are two main tools which are used for ABGs. First is the blood gas analyzer, which is this machine over here, which measures, like I said before, glucose, lactate, bilirubin, and the concentrations of blood gases. Next, to draw the blood, they will use an arterial blood gas syringe, which is used to draw the blood. Now I'll talk about the general procedures. First, a sample is taken from the radial artery. So modified Allen's test is performed to assess the artery. So this is the modified Allen's test. It's just clinching your face so that the radial artery is more presentable. Next, the needle is inserted through the skin at the insertion site at a 30 to 45 degrees angle. The ABG syringe will self-fill in a pulsatile manner, and once that's done, the blood can be analyzed using the analyzer, and the test results will come in within 10 to 15 minutes.
The case study that we choose for this topic is arterial blood gases during and their dynamic changes after cardiopulmonary resuscitation. And this case study basically tells us the usage of ABGs in the cardiac arrest conditions. And now let's move to the application of the ABGs. Usage of ABGs samples in diagnosing CPR. Okay, what is CPR? First of all, CPR is a life-saving method when a person's heartbeat is stopped during an emergency situation. And the procedure of CPR is the typical one, where the person will perform chest compressions. Cardiac information is crucial to the treatment of cardiac arrest, which can maybe obtained from an ABS analysis. Within the context of a prospective multi-center experiment, this case study analyzed ABG samples collected during out-of-hospital cardiopulmonary resuscitation. Medical diagnostic of ABGs in the CPR. So this one we can divide it into two parts. First one is ABG analysis during ongoing CPR. Okay, the table here shows the blood gas parameters that are obtained. PaO2 is blood gas tension, PaCO2 is partial pressure of CO2, EtCO2 is End-tidal CO2. AAD CO2 is arterial and alveolar end-tidal of CO2. pH is the pH value, and B is base excess. ABG sample had been drawn under ongoing OH CPR to identify the characteristics and blood gas parameters of patient with ABGS analysis. The doctor may be use these values to determine whether the patient is experiencing arterial alkalosis or arterial hypokenia, and this information can be used to uh, consult the patient for further therapy and further uh, diagnostic after the CPR. Okay, now let's move to the second one, ABG dynamic intra and post CPR. This one is before the CPR and after the CPR, and the table here shows the parameters that obtained by using the ABG. Before and after CPR, the patient had an arterial blood gas taken for analysis. In order to continue diagnosing the patient and perhaps avoid another cardiac arrest, the doctor analyzed the parameter provided in the table above.
So okay, next, I'll talk about the limitation and disadvantages of ABGs. First of all, it is invasive since a blood sample needs to be taken from an artery, a more invasive procedure compared to taking blood samples to a vein. It could cause major bleeding or infection if done incorrectly. Next would be time constraint, as ABG it needs to be analyzed after the blood is drawn within 30 minutes, so it's a very small time frame, and the results are not available immediately after being drawn. So next, we have a higher cost. ABG testing can be relatively expensive, especially if the number of samples required are higher than one. So you need to take a few, which are going to be more expensive than usual. Another disadvantage could be false normal results, where if the patient have other medical conditions that alter their acid-base status of the body, it might not report the correct result, such as if the patient has a metabolic acidosis. And next, finally, we have limited information from the test, since this ABG test only provides information on the level of oxygen, carbon dioxide, and also pH in the blood. Next, we look at ethical considerations for the ABG test. Number one would be consent, since it's going to be invasive, so we need to inform the patient whether if they would consent to being injected to draw blood samples. Next would be pain, since it is an invasive procedure. It is possible to cause pain unless appropriate measures are taken. Next would be autonomy, since let's say if the patient is critically ill and cannot make their own decision, this procedure needs to be performed in which it respects the patient. And finally, confidentiality. ABG test may contain sensitive information about the patient's health, so needs to be careful when handling the information and results. Okay, that's all from me.
Next, we're moving for the comparison of ABG with other device. So we have three devices here, which is pulse oximeter, ABG, and also VBG. So difference for the first difference is the sample source, which is the oximeter use the fingertip for the source, while ABG and VBG directly take from the blood vessel, which is artery and vein. ABG for artery and VBG for the vein. And it's also measure the partial oxygen, but for oximeter, it's only measure percentage of hemoglobin that saturates with oxygen. And for the pH measurement, there's no pH measurement available in the pulse oximeter, but ABG and VBG do have the pH measurement, but ABG is more accurate on the pH measurement. And for the clinical use, pulse oximeter usually used for monitoring the oxygen saturation level, while the ABG often used for evaluating and monitoring the pH, partial oxygen, and also partial carbon dioxide in the patients, while VBG often used for the screening tools. And for pulse oximeter, it's quite inexpensive, non-invasive, and easy to use, so it's commonly used for monitoring the blood oxygen level for the patients, while the ABG is quite invasive, costly, and high skill needed to perform this test, while for VBG it's invasive and quite less reliable, as ABG has more accuracy than VBG.